Anegos. He was 7 years old, admitted in Corynebacterium at PICU with the chief complaints of high-grade fever, cold, cough, swallowing difficulty, vomiting, and tiredness. After the investigations like CBC, throat swab test, he was diagnosed as diphtheria, and he is taking medications like injection ADS, injection crystalline penicillin, tablet erythromycin. Patient biographical data. Patient name Master Anagosh, 7 years old. Your date of care started 13 to 2025. Date of care ended 17 to 2025. His chief complaints are high-grade fever, cold, cough, vomiting, swallow difficulty, tiredness, diagnosis diphtheria. Patient present illness. He was having a chief complaints like high-grade fever, cold, cough, swallow difficulty, and vomiting. His past illness. He doesn't have any past history on medical illness. Next is family history. His family doesn't have any communicable diseases like tuberculosis, diabetic mellitus, asthma, asthma. His socio-economic background. He was coming from nuclear family. He having a proper electricity food system on his home. His personal hygiene. He doesn't have any allergy on foods and medicines, and he doesn't have any skin allergies or any other difficulties on his personal life. Next, his physical impressions. He was very thin and he is under the anemic condition. He is also having neutrophilia, and he having an iron deficiency in his conditions. Next, we have a conjunctiva. By a physical examination, we have this impression on my patient. Next, we have taken investigations like CBC and throat swab. In CBC, we have found that he have iron deficiency. On throat swab, the smear shows that gram-positive bacilli and gram-positive cocci, which shows the presence of diphtheria. Next, diphtheria. Diphtheria is a serious bacterial medical condition that spreads to the mucous membrane of nose and throat. There are two types of diphtheria present: respiratory diphtheria, cutaneous diphtheria. Respiratory diphtheria is spread through the airway of our body. Next, cutaneous diphtheria is spread to our skin. These are the diphtheria types. Now we are going to see about the common etiology of diphtheria. Adila will say the common etiologies.
Respiratory droplets, contaminated objects, Corynebacterium diphtheria, contact with wounds, not vaccinated.
Actually, my patient was not vaccinated with the diphtheria, because we have been now Indian system have followed many systems to take a vaccines, but some of them are not awareness about the vaccines. So he was not taking the diphtheria vaccine, and that's why he was under the condition of diphtheria. Next, we are going to see the common clinical manifestations of diphtheria.
Clinical manifestation: gray membrane covering the throat, sore throat, swelling gland, difficult to breathing, nostril discharge, fever and chills.
My patient have a sore throat, hoarseness, difficulty in swallowing, difficulty in breathing, fever and chills. These are the signs and symptoms of my patient. Next, we are going to see the pathophysiology of diphtheria. Diphtheria is spread through the microorganism of Corynebacterium diphtheria. Corynebacterium diphtheriae goes to the respiratory tract. Then it attaches to the superficial layer of skin injury or respiratory mucosa. It forms a pseudomembranous and relaxed, strong polypeptide 62 kD exotoxins and inducing local inflammatory reactions. Lymph nodes start to swell and contain a toxin, local tissue necrosis occurs. Then the respiratory tract infection will occur. Next, we are going to see the diagnostic evaluation of diphtheria.
Diagnostic evaluation: history collection, physical examination, swab test, culture test, elect test, travel history, immunization test status.
We have collected the history collection from the Anegos, and and physical examination. From the physical examination impression, we have been seeing the physical examination, and we done a CBC test. Then we done a throat swab test. By the throat swab test, we see the impression like he have a positive gram positive bacilli and gram positive cocci was present to him. Next, we are going to see the management of the diphtheria.
Medical management, amoxicillin, macrolides, penicillin, erythromycin, and the surgical management, tracheostomy, cryptothyroidectomy, endotracheal intubation.
My patient doesn't have any serious condition to take the surgical, but he is taking a medications like injection ADS, injection crystalline penicillin, and tablet erythromycin was taken. Nursing management. In nursing management, the patient has to be isolated first. Then he taken a medications like injection ADS, injection penicillin, and tablet erythromycin. The patient has to be monitored oftenly. Under the Indian health system, we have to isolate the patient who have a communicable disease was positive. In recent case, the government has announced that the patient who have a confirmed communicable disease rarely like diphtheria, we have to inform to the corporation, and the corporation persons have to see the patient first and then isolate the patient. The Anikosh was also seen by the corporation officers, and later he was isolated from the PICU to the isolation ward. Through this presentation, we are now able to know how to give the care the diphtheria patient, and what are the precautions and medications has to be taken for the diphtheria patient was seen. Any doubt for anybody?